I want to thank the organization for the kind invitation to present in this session. I have no financial interest. As you know, neovascular AMD accounts for 15% of AMD cases. The presence of choroidal neovascularization in the fellow eye is an established risk factor for the development of neovascularization with an annual incidence up to 19%. Therefore, screening for early detection of CNV is becoming increasingly important as it may have both therapeutic and prognostic implications. Fluorescein angiography detects choroidal neovascularization by identifying the presence of leakage from incompetent vascular tissue. So the CNV must be an exudative lesion to be seen on FA. The Quiescent CNV, which is a new described entity, is a sub-RPE type 1 neovascularization defined as a fibrovascular plaque in the late phase of ICG angiography without leakage on fluorescein angiography, in showing the absence of anteretinal or subretinal exudation on repeated OCT for at least 6 months. OCT angiography is a fast, non-invasive tool to visualize retinal and choroidal vasculature and detecting CNVs. The characteristics of OCT angiography in Quiescent CNV secondary to age-related macular degeneration were first demonstrated in 2015. In that publication, non-exudative CNV were detected on OCT-A in 2 fellow eyes of 20 patients with unilateral exudative AMD without any sign on fluorescein angiography or structural OCT. Afterwards, other publications about OCT-A in Quiescent CNV and asymptomatic CNV were published. They demonstrated the reliability of OCT-A in detecting Quiescent CNVs with 82% sensibility and 100% specificity. In our study, we explored the fellow eye of 13 patients with unilateral neovascular AMD. All patients underwent fundus examination, structural BScan and en-face OCT, OCT angiography, fluorescein angiography, and ICG angiography. OCT-A revealed the presence of this kind of small vascular network in the 3 eyes in the level of the outer retina and sub-RPE slab. CNV projection artifact was visible on the choriocapillary slab as well. On structural OCT, it corresponded to this flat hyperreflective elevation of the RPE with visualization of the Brooks membrane, consistent with the type 1 CNV. ICG angiography showed the Quiescent CNV in the 3 eyes, appearing as a late phase plaque on the ICG, and the en-face angiogram image corresponded well with the limits of the ICG plaque. Fundus examination was either normal or showed RPE changes in one eye and macular degeneration in the last eye. On the other hand, fluorescein angiography was either normal or showed hyperfluorescence due to RPE changes without leakage from any evident CNV. During follow-up, the first case remained stable after 18 months with a slightly decreased intensity of the lesion. In the second case, we noted after 12 months an enlargement of the Quiescent CNV with a higher density, but structural OCT didn't show any sign of exudation. However, the first patient who initially presented a Quiescent CNV with poorly defined shape and small irregular elevations of the RPE and with a good visual acuity, he complained at the 7th month control about functional worsening with metamorphopsia and loss of vision. So we repeated the OCT-A, which showed this obvious enlargement of the lesion with a well-defined medusa head shape in the outer retina slab with a projection artifact on the choriocapillary slab. On OCT, structural OCT, it corresponded to this vascular RPE detachment associated with a subretinal fluid. So the Quiescent CNV transformed after 7 months into an exudative lesion, which required an urgent treatment. In conclusion, OCT-A can detect Quiescent type 1 CNV non-visible on fluorescein angiography. It could be an efficient screening tool for patients with unilateral neovascular AMD or dry AMD. Moreover, Quiescent CNV require close surveillance as they are more likely to progress to active symptomatic forms of exudative CNV, and of course further studies are needed to better understand the clinical significance of these Quiescent CNVs, their evolution, and whether or not to treat them. Thank you very much for your attention.